So there's no evidence there to show that a person donating blood could extract or could contact this particular virus. We will, of course, take precautionary measures, have the donors wash their hands, maintain the social distance, so as to eliminate the transmission from persons to persons. But there's no evidence that show that a person could actually get this particular virus through blood donation. Also, there's no evidence with the SARS, and also there's no evidence also with the MERS-CoV, which also are coronavirus. So there's no evidence there to show that you could transmit it through blood transfusion. A lot of persons been calling saying that the blood donation will reduce the immune system and they will extract the virus and so on and so on. No, there's no evidence out there that points that you could get it through blood donation. Also, there's no evidence that points that you could get it through transfusion, blood transfusion. But of course, the reason being is because, of course, the blood bank is a respiratory disease, and the screening part of the blood bank is the most important part. We will ask you questions about you having a cough, we will ask you questions about fever, we ask you questions if you're feeling well today and all of that, so that those persons will eliminate them from donating. But as long as you're okay, you have no fever, you have no coughing and so on, you could come and donate. As long as you're a regular donor, you could come and donate. You could access our regional sites too, which is in Saudi, Region 3 at Westdam Hospital, Region 10, Linden, and Region 6 in New Amsterdam Blood Bank. We need you now more than ever, because we still have pregnant mothers in the hospital. We still have patients who need surgery. You understand? We still have these high-risk patients, cardiac surgeries and all of that going on. That wouldn't ease. So we encourage persons to come out, come and donate at the blood bank. There's no risk involved. It's very important, the social distancing. It's very important person wash their hands. These are simple things we are asking persons to do. I have seen a person taking the virus for granted. Please, it's important that we follow the guidelines, because a case of a huge outbreak in Guyana, I think it's very difficult for us to manage such outbreak because of the amount of beds, ICU beds, and so on over there. So we ask in person, please follow the guidelines. Please follow the guidelines. Avoid crowd, parties, and so on. Wash your hands, of course. That's very, very important, because other person may go around, touch areas that's infected and so on, and then wipe the face and so on. So we encourage. And even if, like I said before, the thing about this disease is that most persons are symptomatic. It might not affect you as a young person, but you might have your granny at home. You understand? You might have your grandfather at home, and you will take it at home, and this is where it becomes deadly. So it's very important as young persons, and old folks too, that we take the precautionary measures. Think about others. Don't only think about yourself. Please think about others, because it might not affect you, but it might affect somebody with comorbidities, like, of course, diabetic patient, person with heart problems and so on, and you may have those persons at home. So it's very, very, very important that we take the guidelines serious.